Hi, thank you for joining my channel today. Welcome back. I thought I'd bring a very interesting topic. I'm trying to bring more interesting health topics to my channel and provide a roundtable discussion or provide something for you to think about in your health, because we all go, this is the idea of having weight loss surgeries to improve ourselves, not only emotionally, physically, our health, our relationships, everything. And I think a lot of times we neglect our dental health because in my research, I found that in my personal research, in my personal weight loss surgery, I've had complications related to my lap band. And I had the lap band placed in 2012. And my dentist really pointed out some possibly side effects that are associated with my weight loss surgery, and some of the side effects that I've experienced along the way due to complications of gastric reflux disease, the acid going up into my stomach, and the consisting PB or vomiting for most of the time that I've had my lap band in. I had it unfilled in 2016. So I don't have any fluid in my band, and that decreased the PBN or the vomiting or the gastric reflux. It has decreased throughout since I had it unfilled in 2016, but the damage has been done to my teeth. And I have to go through another restoration process. My teeth are basically ruined. So I have to go through thousands and thousands of dollars to restore my teeth again. I went through a 3-year restoration. I restored my teeth from 2004 to 2006. And then in 2012, I had my lap band placed. So my teeth have really declined since all this has happened. And can I put it to the blame of my lap band? No, due to, maybe nutritional deficiencies, maybe due to age, maybe to bacteria, may to be due to improper dental hygiene myself, my own personal neglect. There's a lot of things that could be stemming from my dental issues now. But regardless, I have to spend thousands and thousands of dollars to restore my teeth. Well, as you know, I have no dental insurance, and I'm broke, I'm jobless, I have no dental insurance. And then, here in the United States, we basically have private dental insurance. And a lot of times through the years, the dental insurance have been decreasing to cover preventive care and restoration care. So a lot of times we have to pay out of pocket. I mean, I've spent thousands and thousands of dollars to restore my teeth through bridges, veneers, just to make sure that my teeth were presentable. Because as weight loss surgery patients, we're trying to restore our body. We're trying to restore our performance, our appearance, our health. And naturally, we want to restore what? Our face, right? Because when you look at me, you're looking at my face. What are you looking at? You're looking at my teeth. Well, I have a broken tooth that I need fixed. Yeah, that just broke. That broke about a year ago. I couldn't afford another veneer, so he had to. What do you call that? Repair it with a filler, and he said that it wouldn't hold. So now the tooth is dead. And I need some work on that bridge. That bridge needs to be taken off. I have a decay under the tooth. So I have a lot of dental issues that I need to take care of this year, and I don't have the funding to do it, and I don't know what I'm going to do. I'm in a conundrum again. So anyway, I wanted to share with you today. You might want to do a Google search, because I don't want to call anybody out. But there are people in the weight loss community that said their teeth have been ruined by their weight loss surgery. Their teeth have fallen out of their mouth, and they have severe dental issues, which could be caused by a number of things, not necessarily the weight loss surgery, but whatever goes on as we go through this path, right? depending upon what kind of surgery you have, if it's malabsorption. I didn't even realize in this video that I'm going to show that, yes, Lapbanders, even though we don't have any malabsorption, but we do have complications due to our surgical tools, so to speak. There is there's a balance. We're damned if we do, we're damned if we don't. There's always complications in everything that we do, seems to be anyway. So, so you need to take your vitamins. You need to do proactive dental care. Make sure you go to the dentist at least twice a year for dental checkups. You need to use proper dental hygiene, floss your teeth, brush your teeth, whatever your dentist advised you to do. And try to do your due diligence and do the best care that you can to eat properly. Try not to throw up. Try not to get gastric reflux so that all the acid goes back and into your mouth. Dry mouth, I learned on this video, causes dental issues. Improper diet, improper nutrition, improper calcium. A lot of us women seem to be plagued with it because we have low calcium as we age. Osteoporosis sets in. If we're pregnant, a lot of times, if during pregnancy, believe it or not, it's a real thing, your baby will steal the calcium from your teeth. Know all about it. Know all about it. So if you have a malabsorption procedure, if you have, any of the weight loss surgery procedures, do your due diligence and follow your surgeon's rules. Do your research. All these things make a difference. Take your vitamins. I hear so many people that think it's a big joke. They don't take their vitamins. They think that just because they don't see any outward consequences, there are systemic consequences that are going on. Things that you don't see that are going to erupt years later, and you're going to question, well, gee, could that be from? And you're not going to be able to pin it down. Take your vitamins. Whatever your doctor prescribed, take your vitamins and do your own due diligence. Go for your blood work. Make sure your levels are correct. Get a bone scan. Get a DEXA scan. Make sure your calcium score is correct. Ask your doctor, how is my teeth? How is my gum loss? Do I have any bone loss? Do I have any periodontal disease? Do I have any gingivitis? These kind of things that you have to ask your dentist. Take care of your teeth. I was watching a podcast where they really link, you don't know what to believe. You don't know what to believe, what's real or unreal, who's telling the truth, what doctor's telling the truth, who's trying to take your money, who's trying to sell you something. You really don't know the truth. You really don't know the truth. So you have to use your own personal guidance, your own gut in your heart, your own little voice in the back of your head, your own research, your own due diligence, watch videos, talk to people, listen and read. I just was watching a podcast where they link a lot of neurological diseases to what? Gum disease. A lot of your autoimmune disease is linked to what? Gum disease. A lot of Lyme's disease, the parasite, the spirochete. Yeah, the parasite that goes from Lyme's disease, that stays in your body, lies dormant in a double cell wall where when you put the antibiotic, it puts a covering on the outer shell and it hides. Where can it lie? It can lie in your gums. It can lie in your gums, and it hides in your gums in Lyme's disease until you stop taking the antibiotic and the spirochete comes out and then invades your body again, and you're on this continuous cycle, that stupid autoimmune Lyme's disease that they created on where? Yeah, that island off of Connecticut. What's it called? Operation, what do they call it? Operation something. And it's in Lymes, Connecticut, that big research facility. I digress. But anyway, Look at this video. I'm a science geek, if you didn't know that.
Acetone breath, which is a sign of the ketosis. And when a body is subjected to caloric restriction, which results in the weight loss as one of the mechanisms, the body will end up eventually into a ketoacidotic state. There are 3 forms of keto acids, and 2 of them are soluble and dissolved, and 1 of them isn't. The acetone that's not has to be exhaled primarily, and the vapors is what may contribute to halitosis, and that results in acetone exposing to the teeth and the resultant problems that develop. Dental caries are not necessarily related to one single variable. They're multifactorial: plaque formation, decreased saliva flow, and change in acidity, loss of the underlying foundation of calcium, vitamin D, and minerals, as well as overall poor nutritional state, all contribute to the underlying cause of poor dental status and dental caries. As you can see in the drawing, the picture, there's a fair amount of overlap on this, so you don't necessarily have to have all 4 of them to develop caries, but clearly that central part of it can be caused by all of the variables. So it is important that every single one of those leaves, if you would, are addressed in order to prevent from deteriorating dental condition. Dental caries and where.
So I'm gonna link his video. This Dr. Ara Keshishian, he's actually a bariatric weight loss surgeon, and this is from 4 years ago. But I've noticed on his channel, he has a lot of weight loss surgery related videos that might be an interest to you. So you might want to go check his channel out. Yeah, I mean, my bariatric surgeon, when I had my surgery in 2012, she never said anything about that. Never said anything about that. And actually, this is a subject matter that is really it's not talked about. It's not talked about in the weight loss community until after the person loses all their teeth, and but it's something that's not talked about. But I think it's very serious, because if you're a young person, you're 20 years old and you're having weight loss surgery, you have a long time to take care of your teeth. I mean, I'm 58 years old, so I could really care less if I get them all pulled out. And to get false choppers, I really would like to have false choppers so I can have beautiful, like movie star teeth, and not have to worry about going to the dentist and having the drill and all that kind of stuff, which is very painful for me because I'm very sensitive. I have a very delicate mouth. I don't like the dentist. I was afraid when I was little. I have a low pain tolerance. So I don't know. I'm going to go to the University of Maryland. They have a dental school there, so I'm going to find out what I can do about my teeth, what my next options are, because I can't afford $10,000. I don't have $10,000 to put in my teeth. I don't have $5,000. I don't even have $1,000 to put in my teeth. So I have to do what I can do to restore my teeth, to keep the bacteria from not going into my brain. I'll tell you a story real fast. My brother-in-law, my husband's brother, who's very wealthy, he has a lawyer, and he neglected his teeth for years, and he had like rotten teeth. And I was like, why is so-and-so, why does he have rotten teeth, all rotten teeth on the bottom of his teeth? He's a lawyer, I mean, when you look at somebody's face, you look at their face, or what do you think? You talk to somebody, you look at their face, the first thing you look at is their mouth. And if you see a bunch of rotten teeth or a bunch of missing teeth or cracked teeth, that doesn't look very nice. I mean, I don't want a bunch of cracked teeth. I don't want rotten teeth, and I don't want bad breath, and I don't want stinky breath, or I don't want any. He had a blood clot. He had infection, systemic infection from abscesses from his teeth, went to his brain. He went into a coma. They found him unconscious in his office. He was in a coma for 10 days. Luckily, after antibiotics or whatever, 10 days or 12 days, he came out of it. Everything turned out. He had to have all his teeth pulled out of his mouth, and he had dentures. He let his teeth go for years and years and years. Why? You're a lawyer. You make a lot of money. You drive a Mercedes. You got a big car. Why? I don't know. Take care of your teeth, people. I'll link a card. Thanks for tuning in. See you next video.